My name is Dr. Sean Branham. We're here at my office today at Premier Healthcare. I'm with Jake. Jake's going to introduce himself.
How's it going? I'm a patient here with Dr. Branham, and I own Next Level Performance located out in Oakville, Missouri. We're a private training facility out there.
So what we're here to do today is to take you through a full spinal rehab program. We're going to take it step by step, just as if I was going to give this to my patients. We'll talk about and demonstrate the exercises. We'll tell you the length of time and how to perform them. So what we're going to start with is we're going to take both cervical, which is neck, and lumbar, which is low back. We're going to start with cervical on each one, and I'll explain it as we go. So the first thing that we start with on a patient with a neck problem or neck injury, what happens in a neck injury is there's an injury, typically it's associated with a strain and a sprain. A strain affects the muscles, a sprain affects the ligaments. In either case, what happens is the patient's range of motion is usually reduced and they have a limited range of motion. So the first thing you have to do in any rehab program is you have to reestablish a normal range of motion. So the first exercise that we give to our patients are range of motion exercises. In every spinal joint, you have 6 different ranges of motion, and I'm going to demonstrate those for you. So the first motion you have is cervical flexion, which is forward bending. You have extension, which is backward bending. You have right lateral flexion, which is side bending. Left lateral flexion, right rotation, and left rotation. So forward, back, side, side, turning, turning, okay? The way that we instruct our patients on doing these is we want to do 1 set of 10 in each of the 6 different ranges of motion. So we're going to demonstrate this for you here in just a second, but I want to give you the instructions before we start. We want to do all 10 in one direction, so a 10 in flexion, then 10 in extension, then 10 in right lateral flexion, and so on. We want these to be slow, controlled movements, so all 10 in one direction. This does not count as one for everything, right? You got to do all 10 in one direction. Most importantly, they should be pain-free. So here's what we tell our patients. If you're doing flexion and you start bending forward and you feel pain here, I want you to stop here, just short of it. And what you're going to realize is that on number 10, you can go further than number 1. On your second set, you can go further than your first set. So all we're trying to do with these exercises is to restore a full painless range of motion. Okay? Once we've done that, then we're going to move on to the next set, which we'll go over here in just a few minutes once we get there. So let's demonstrate those. So I'm going to turn sideways. Jake is going to stay straight ahead so we can kind of see it from both angles. And we're going to do a set of 10 in flexion. So any pain that you have, stop short of that pain. Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then extension. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Same thing now, right lateral flexion, right ear to the right shoulder. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And left lateral flexion. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And rotation. Right rotation first. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And left rotation to finish up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. good. So that's a full set of range of motion for the neck. That took us about a minute. Not a big deal, right? It's easy to do. We make our patients do these twice a day minimum. First thing in the morning when they get up, last thing before they go to bed at night. This gets them started for the day, gets their body moving. When they do it last thing at night before they go to bed, then they wake up with less soreness and stiffness in the morning. We tell our patients, if you want to regain your range of motion quicker, do it more than twice a day. Do it 3 or 4 or 5 times a day. It's not a big deal. It's 30 seconds, 60 seconds, okay? We're going to now demonstrate low back range of motion. I'm going to let you scoot forward so we don't bump heads if I turn sideways. So flexion first in the low back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So if you noticed on me, my range of motion improved throughout that one set. I'm kind of showing my age here, but when I started, I was probably 4 inches off the ground. At the end, I was touching my toes easily, okay? Now extension here. Jake was good all along. He's a lot younger than me. All right, extension. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. On extension, you want to be really careful. A lot of people, what I see is their extension is so limited that what they really do is they throw their hips forward to make it feel like they're extending more. And what you really want to do is keep your hips stable and just try to extend over those, okay? And then we're going to do right lateral flexion, so this is going to be side bending. So we're just trying to run our arm, so other way, Jake. Run our arm down so we're touching basically the side of our knee. 2, 3, 4, 5, 6, 7, 8, 9, 10. Same thing to the left. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And rotation to the right first. So keeping your pelvis straight, turn your torso around it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And to the left to finish up. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So these seem real easy, and they are, okay? And they should be. Anytime you're injured, what you want to start with are very basic movements, single movements, which is what we did. Each single range of motion first. As we age, what we tend to lose is our flexibility. Range of motion is perfect for restoring that range of motion and that flexibility. So even if you don't have a spinal injury, these are still great exercises to perform on a daily basis. Jake, some input there?
Yeah, no, I agree. It's one of those things where as you get older, you start noticing you're not moving as much, and to easily add in twice a day some range of motion and movement, it can do wonders for your body to prolong it and stay healthier as you get older. So
I feel looser right now just from that little bit that we did.
Right.
Yeah.
Same here.
So typically we will keep our patients who do it twice a day, we'll typically keep them on these exercises for about 3 weeks. If a patient wants to regain the range of motion quicker, they're a little more aggressive, then we'll typically keep them on in a week and a half to 2 weeks. We'll just reassess their range of motion to determine if they're full or near full. A patient might not regain all their range of motion at the beginning with range of motion, what we find is that some people do, but some don't. And what limits that last 5 degrees or so can be muscle tension, muscle tightness, right? So your muscles are still tight, which is where that second set of exercises comes in, which is stretching. Stretching exercises are done to relax the muscles. And if a patient's at 95% of range of motion, we'll go ahead and move them on to stretching because that helps them regain that last 5%. Stretching exercises everybody loves because they feel good. They feel that things are getting better, that they're loosening things up, okay? So we're going to start with cervical spine first. We're going to go through the instructions for stretching. So with stretching exercises, again, they're going to be done twice daily. However, we're not doing 10 repetitions. We're only going to do 3 repetitions. We're going to get to a point of stretch. We're going to sustain that stretch for 30 seconds. We're going to hold it. We are not going to bounce. Bouncing is how you tear things, okay? So again, I'm going to turn sideways. Jake's going to point straight on. The first motion we're going to do is just a flexion stretch. So you're going to bend your chin to your chest. You're going to interlace your fingers. You're going to let the weight of your hands rest on the back of your head. You're going to hold that for 30 seconds. And you can feel all the muscles in the back of the neck stretching out here. I'm not pulling. I'm not pushing on my head. I'm just letting the weight rest there. So you're going to do that for 30 seconds. You're going to repeat that 3 times. Okay? The second stretch is an extension stretch. This is done to stretch the front neck musculature out. So we're going to extend the head back all the way. Hold that. Count to 30. And we're going to do that 3 times. Okay? So pretty simple stuff, and these feel good. They really do. The second stretch we do for the cervical spine is similar to the first, but now we're going to do a coupled motion. So we're going to flex the chin to the chest while slowly turning the head to the right. We're going to rest our hands on the back of our head, and you're going to feel that stretching on the back right side. 30 seconds, 3 times to the right. 30 seconds, 3 times to the left. Okay? These actually feel good. Jake, tell them what you feel when you do that.
I feel like a nice stretch running back through and through here, my neck.
Exactly right. Through the posterior and lateral neck musculature on the side that you rotate to.
Yes.
Okay? So the next stretch we're going to do is also for the neck, and it's going to be for the side muscles of the neck. So we're going to actually clasp our hands behind our lower back here. We're going to drop our right shoulder, and we're going to bend our left ear to our left shoulder. So we're literally stretching out the whole right side of the neck. And that feels really good.
Mm-hmm.
So 30 seconds, 3 times to the right, 30 seconds, 3 times to the left. Okay? The next stretch that we're going to do, we're going to actually take 3 motions and we're going to couple them together to actually have the best stretch that you can get on your neck. Okay? So you're going to clasp your hands behind your low back. You're going to flex your chin to your chest. I'm sorry, I did that in the wrong order. We're going to bend our right ear to our right shoulder. Holding that position, I want you to rotate the head to the right. So there's not going to be a whole lot there, right there. And then the third motion is to flex the chin forward towards the right armpit, holding those 2 positions in. And you're going to feel a tremendous stretch on that back left corner, kind of a 45-degree angle on the back left side of the neck. Okay? If you want to make that stretch even better, before you start, drop the opposite shoulder. So drop the left shoulder, flex the right ear to the right shoulder, rotate to the right, flex forward. And that's a huge stretch. Okay? Does that feel better than the last one?
Mm-hmm.
Good. So the biggest mistake I see on that stretch is that people don't couple the motion. So I will tell them, bend the ear to the shoulder. They'll do this. Then I tell them, turn the head to the right, and they do this. They take the first stretch out and just add that. So we're really coupling the motion because that's when you really stretch those tissues out. So again, here, here, here. And that's a tremendous stretch, okay? The next stretch is a stretch for the shoulders, chest, and arms. It's kind of done in the threshold of a doorway. So the arms go up on the door frame. And what the patient does is they lean forward, and you're going to feel it stretching all throughout your chest and your shoulders. You're going to maintain that, yep. And you're going to maintain that for 30 seconds, and that feels tremendous too. Okay? So 30 seconds 3 times on each of these stretches, twice a day, morning and evening, and it doesn't hurt if you want to do it more than that, okay? These take a little longer than the range of motion, but most people will spend that time because they feel better. The last stretch that we do for the cervical spine is for what we call the suboccipital muscles. Those are the muscles right under the skull, okay? So what we do with this stretch is we're going to lie on our back with our head on a pillow. We're going to tuck our chin in like this, and we're going to push our head into the pillow for 30 seconds. And what that does is it stretches the muscles right under the skull. It feels actually really good, okay? Jake, some input on those?
Not much.
Okay.
Not much.
Good. So what we're going to move on to now, that is the neck, and that's the second set of stretches that we do in a rehab program for our patients. And again, you do not have to have an injury to do these. These are good for everyone. And I will be honest with you, every single patient needs to stretch more.
Yeah, one little tip, just to add in, I know a lot of us are on our phones more, we're on the computer desk a lot more at school, so adding in this neck movement and these neck stretches can do tremendous work due to the fact that we're always hunched over looking down. So like you said, you don't have to be injured as it is, we can be proactive and staying healthier with our movements.
Yeah, one of the biggest, newest diagnoses in the last 10 years is what they call text neck, right? So everybody's like this all day long. So these are good for everybody. I don't care who you are. You don't have to be injured to do them, okay? We're going to move on now to stretches for the lumbar spine. So again, this is the second set in a rehab program for injury. You do not have to be injured to do these. Your instructions are the same here. We are going to do these twice a day. We're going to do 3 stretches on either side, 30 seconds each time. So I'm hoping that this translates good because it's going to be maybe hard to see this one. We might scoot forward a little bit just to get a better close-up of it. So the first stretch we're going to do is for the quadriceps and hip flexors. So what we're going to do is we're going to spread our feet out 2.5 to 3 feet apart. Most people don't do that. What they do is they spread their foot about a foot and a half and they turn their foot sideways, which is wrong. We want both toes spread straight ahead, right? And typically when you do these, you want to be holding on to a couple chairs or something so you're stable, okay? What we're going to do now is we're going to keep our back up straight just like we are. We're going to lean all of our weight into our front knee, keeping our back knee just off the ground. So all the way to the ground. And you're going to feel a tremendous stretch in your upper quad and even up into your abdomen, which is your hip flexor. You're going to hold that for 30 seconds. You're going to do it 3 times on both sides. And this feels phenomenal. I actually need this one right now because I did legs the other day. Good. All right. Second stretch we're going to do is a hamstring stretch. I'm going to look at my cheat sheet here. I'm forgetting one of those. Is a hamstring stretch. So I'm going to actually demonstrate this probably with Jake on the floor. So Jake, if you would lie down for me. If you have another person to help you stretch, you're always going to get a better stretch. We don't always have that. So the way we instruct our patients to do the hamstring stretch at home is to take a bath towel, wrap it around their heel, and bring the leg up that way. Because if you're pulling your leg up under its own muscular power, you're not totally relaxed and you're not getting as good of a stretch, right? So if he were at home, I would tell him take a bath towel, wrap it around your heel, pull the leg up. Since I'm here, I'm going to help him, okay? So let that leg totally drop and relax. Good. So I'm going to let him control the stretch. He's going to tell me when to stop. When he feels tension, he's going to feel it behind the knee. And I can feel it getting tight already. Tell me when. Good there. Okay. So the key to the hamstring stretch is keeping the leg straight. If we bend the knee just a little bit, how much stretch do you feel?
Nothing at all.
None, okay? So the key is keeping the leg straight. That's why I like the towel, because the towel allows you to pull from the heel and it provides a lever so you feel that stretch, okay? So we would do this for 30 seconds, 3 times on each side. We use an accelerated form of stretching on our patients in the office where we contract, or we stretch the muscle first for 30 seconds. Then we contract it against a resistance. So what Jake would do if he were in my office is I would stretch this for 15 or 20 seconds first. Then I would throw my shoulder in here and I would ask Jake to push this leg down, try to get his leg back to the floor. What I'm doing there is I'm fatiguing the muscle so that it wears it out. And when I stretch it again, it'll stretch further. So then I would let go and I'd say, tell me when. And he just gained about 20 degrees after contracting it for about 12 seconds. Okay? So that's another way of really accelerating that stretch. Good stretch. And as you get that hamstring stretched out, you're going to feel it move from the back of the knee down into the hamstring itself. Okay? The other way that I do this stretch at home is I do this in a doorway. If I lay in a doorway and I let one leg down the hallway or in the room, and I stick my buttocks and my leg up against the doorway, I'm at 90 degrees and I'm fully relaxed, and it allows me to get to 90 degrees immediately without struggling and pulling on a towel. Okay? If I go past 90 degrees, then I'll just throw a pillow or two behind my foot, which then will put me at 100 or 110 degrees. Okay? All right. Let's have you jump up, Jake. Got it? Yep. All right. The next stretch we're going to do is another stretch for the quadriceps and the hip flexors. So what we're going to do here, again, probably holding on to something is the best, is we're going to grab that leg, your ankle, and pull the leg in, right? Most people are somewhere like this. I want the leg in straight by the other leg. And what we tell our patients then is we want it to go from the quadricep up into the hip flexor. The hip flexor is actually part of the low back. So we're going to pull that leg straight back. I'm going to turn sideways so you can see this. Let's go this way. So here's where I start. Then I'm going to pull the leg straight back as high as I can. I'm not leaning forward when I do it. I'm still standing up straight, and I'm pulling it straight back. And what happens when you do that is that stretch goes from your upper quad up into your abdomen, into your hip flexor, and that's a tremendous stretch. And a lot of times you'll find patients that have a hip flexor, which is called the iliopsoas, that's stuck in a state of contraction, and it causes a lot of low back pain. So you can immediately relieve low back pain by doing these stretches in a lot of cases. Statements, Jake?
No, stay on top of your stretching.
Yeah, it's huge. Jake's into training people and making them stronger. And he said something earlier today that I thought was really good when he said about
length is strength.
Length is strength. That's exactly right, right? We know that Jake, when he got here, had some pretty tight hamstrings, and we identified it. He asked today about, how much should I be strengthening as opposed to stretching? And my response was, do both. Right? Because if a muscle is contracted, which his hamstrings were, he can exercise it all day long, but it's not getting stronger, right? Because it's already contracted at rest. So when he lengthens that muscle and he's exercising in the same time frame, in the same week while he's stretching, every time he lengthens that muscle, then it has the ability to grow and get stronger. So length is strength, and he's exactly right, okay? The next stretch we're going to do is a stretch for the calf muscles. So I'm going to let Jake demonstrate this, kind of use that bookshelf there. I'm going to turn this a little bit. Jake is going to hold on to the bookshelf. He's going to, or the wall, yep. He's going to bend his right knee, drop his hips towards the wall, and he's going to make sure that his left heel stays down. In fact, when he gets with his body dropped towards the wall, he's going to push his left heel into the ground. As he pushes his heel into the ground, what do you feel?
A good calf stretch.
Yeah, it intensifies that calf stretch. If you pull that heel up, Jake, what do you feel?
Nothing.
No stretch at all, okay? So the key to that stretch is keeping that back heel down, yep, and even pushing it into the ground intensifies the stretch. So again, 30 seconds, 3 times, twice a day. Good. All right, the next stretch we have, I'm going to grab a chair, is a full spine stretch. This stretch here, Jake, I'll let you demonstrate this one again. I call this the tornado drill, right? So Jake is going to scoot forward on the edge of the seat. He's going to bend forward, spread his knees apart. He's going to grab his ankles, and he's going to tuck his head as far under his behind as he can, okay? And what he's doing is he's stretching out his entire spine right here. Jake, what do you feel?
I feel a great stretch running from here to the top.
All the way to your skull, right?
Yep.
All the way to your skull. And the key to stretching also is breathing. We do not want to hold our breath when we stretch. We breathe in through our nose, we blow out our mouth, and that actually allows the muscles to receive more oxygen, and you'll actually feel lengthened. You might even get some things that pop while you do this and start moving better too, okay? So this is a fantastic stretch. So 30 seconds, 3 times there. The last stretch we're going to do, jump up for me please, is one that you're probably familiar with if you do yoga. In yoga, I think they call this the cat and the cow, right?
Yeah.
Okay, so Jake's going to demonstrate it again for us. So we're going to do the cat first. You're going to be down on all fours. Jake is going to arch his back up as he arch it up, bring it up. Yep, just like that, and he's going to tuck his head down. So he's hunched his whole back up, and he's essentially stretching his back now, right? With it arched. He's going to hold that position for 30 seconds. From there, he's going to drop his belly towards the ground. He's going to stick his butt out, and he's going to arch his head back. And he's going to hold that position for 30 seconds. This stretch feels amazing. Both ways. Okay? Good. Jake can jump up for me. So again, that set of exercises, so let's recap. The range of motion are the first step in a rehab injury program, but just smart for everybody because it helps restore range of motion. The second set, once our range of motion is full or near full, our muscles are still stuck in a state of contraction, so we're getting them to loosen up. So stretches is what loosens those muscles. Patients who do those stretches for 3 weeks, typically they're at about maximum effectiveness with the stretches. Does that mean they never need them again? No, maybe they don't need to do them every day, but still every other day is a wise decision, okay? Once the range of motion is restored, the muscles are relaxed, now it's time to strengthen, okay? What we're gonna do here, since we have a table to use, we're gonna use it. At home, you're gonna do these on a floor because they have to be done on a hard surface. They cannot be done on a couch or a bed. A soft surface offers zero support, so we do not want those on those surfaces. So we're going to move the camera a little bit. We're going to adjust a table or two here, and we'll show you these strengthening exercises. You comfortable showing these, or you want me to? Okay, cool. All right. So let's scoot the camera up just a little bit. Yep. Well, we're going to start on your back first. All right. So what Jake is going to demonstrate. So what we're now going to do is some core strengthening exercises, okay? So what we have in core strengthening, I'm going to stand here so I'm not blocking him, is we basically have 2 exercises. Each exercise has 2 parts. We have crunches, both upper and lower, and we have extensors, both upper and lower. So Jake is going to demonstrate the crunches first. The most important part of a crunch is your breathing. The abdominal muscles are called accessory muscles of respiration. What that means is that every time we inhale, the ribs raise up, which allows the lungs to expand and full of air. Every time we exhale, the ribs drop down, mechanically compress the lungs and help us to expel or expire air. So if we look at that statement in reverse, if the lungs are empty of air, we're going to get a fuller contraction on the abdominal muscles and they're going to be stronger, okay? So, Jake, as you see, is going to bend his knees. Anytime we do crunches, we want your knees bent. Why is that? Well, if your hamstrings are tight and you are legs down, demonstrate that for me, please, then what you're doing is you're actually pulling on the low back, right? The hamstrings are the only large muscle group in the human body that crosses 2 joints, crosses both the hip and the knee joint. So regardless of whether your hamstrings are tight or not, we always want your knees up when you're doing the crunch. So bring your knees up for me. You can set them like Jake's is doing. You can put them on a chair like this if you want. You can cross them. I don't care. I just don't want them straight. Okay? Jake is going to cross his hands on his chest. We do not want to put our hands behind our head. Number 1, we may pull and strain our neck. Number 2, if our hands are on our chest, we're forced to use our muscles of our neck, and we're going to strengthen those too. Okay? As I said before, your breathing is the most important thing about doing crunches. So we're going to breathe in through our nose. We're going to breathe out our mouth. We're going to start our crunch when we're halfway exhaled. We're going to finish our crunch when we're fully exhaled. Okay? So Jake's going to demonstrate that for us in just a second. What I want to tell Jake and what you should need to know at home is I want you to pretend that you have a basketball sitting on your stomach. And a crunch would be just enough for you to touch that basketball. It's not a full sit-up. A full sit-up is going to work the hip flexors, where a crunch is going to work the abdominals. Okay? Jake's going to demonstrate that for us. Breathing in through the nose, out the mouth, halfway exhaled, blowing out the entire time, inhaling as he comes down, exhale as he comes up. Exactly right. Couple more just so they can see. Good. So those are your upper crunches. That's going to work from Jake's rib cage to about his belly button. Okay? So now we want to do the lower crunches. These are much tougher. Jake is going to move his feet closer to his butt. He's going to hold his butt up in the air while he does the crunch. So what you're going to notice is there's a lot less upper body motion, but I promise you, you're going to feel it low on the belt line. Okay? In order to get your head and your shoulders up a little bit, you have to contract your abdominals, your pelvic floor, your butt. Everything is getting contracted. Your breathing instructions are the same. Go ahead, Jake. Good. Do a couple more, let them see that. Easy or tough?
That's tough.
That's tough. Where do you feel it?
I feel it down and through here.
Where else?
I feel it a little bit up here, but
In your chest?
Yeah.
How about your butt?
I feel the more or less like deep in your butt.
Your pelvic floor.
Yes.
Is exactly right,
Yep.
right? These are great for all kinds of things. People who have like urinary incontinence, these are great for those. These are great for pregnant women. These are great for everybody, really. The core has to be strong if you don't want back pain, okay? So those are your upper crunches and your lower crunches. So again, we would do 2 sets of 10 twice a day. On the upper crunches, 2 sets of 10 twice a day on the lower crunches. And again, you can do more than that if you want, but we try to be realistic in what we give our patients to do. If we give them too much, then the paper's going to go in the trash can. They're not going to do anything. Okay? All right. But you can certainly do more than that. Let's flip you over, and we're going to do extensors next. Okay? So what we're going to do here, so we're going to place our hands under our hip bones, not behind our back. So do that again. I'm glad you did that. So a lot of people will do these exercises with their hands back here, but what I find is that a lot of people, especially as you get older, have shoulder injuries. And if you place your hands behind your back, what you're doing is you're placing a lot of stress on your shoulders. So what I instruct my patients to do is to place their hands under their hip bones, these bones right here in the front. It's called your anterior superior iliac spine. We're going to place our hands under there. We're going to let our elbows drop towards the ground. Our breathing instructions are the same. We're going to breathe in through our nose. We're going to breathe out through our mouth. We're going to start the exercise when we're halfway exhaled. If you've ever watched a weightlifter or a power lifter, notice that when they're lifting heavy weights, they're always blowing out. And that's because it's called a power stroke. You have more power when you're exhaling. We're not doing it for power. We're doing it to get a fuller contraction on the muscle to make the muscle stronger, okay? So with our upper extensors, what we're going to do is we're going to take 3 motions and we're going to couple those motions all together. Jake is going to break them down one by one, and then he'll demonstrate them all together to show you. So the first motion he's going to do is extension of the neck. So he's going to breathe in through his nose, breathe out his mouth. He's going to extend his head and look up as high as he can. Go ahead, Jake. Good. From there, he's now going to do protraction of the scapula. He's going to roll his shoulder blades together by trying to bring his elbows as far back together as he can. Yep. The third motion is extension of the thoracic spine, the upper back. So now he's going to raise his chest up off the table as high as he can. Okay, so there's the 3 individually. Now Jake's going to put them all together with the breathing in through the nose, out the mouth. Good. Let it all fall again. Do it again. Couple more just so they can see. Jake, where do you feel that at?
Down running through my spine and even up towards my upper back.
Yeah, neck, upper back,
Yep.
lower back. Do you
The
feel
whole
it in your
back.
your glutes too, in your butt? Yeah.
You're squeezing.
Yeah, you
Yep.
feel it in your shoulder blades too because
Oh,
you're
yeah.
actually drawing your rhomboids together to do that. So this strengthens, we call it upper for the upper back, but quite honestly, it strengthens the entire spine, including the glutes too.
Yes, all those
Okay.
muscles around the spine.
Yep. So those are your upper extensors. Now what Jake is going to demonstrate to you, I'm going to move to the head of the table. I'm going to turn the camera a little bit, is he's going to demonstrate the lower extensors to you, and I will tell you these are much harder, okay? Most people, when you look at the stomach and the back, what we have to do to strengthen someone who's had an injury is what what we call balancing the flexion extension ratio. Flexion, remember, is forward bending. Extension is backward bending. Well, what is the flexion extension ratio? Well, the flexion extension ratio is 2 to 1. Your back should be twice as strong as your stomach. So 1/3 to 2/3, right? So people say, well, do I lift twice as much weight with my back? No, you lift what's appropriate for you, but your back should be twice as strong as your stomach, okay? And if you look, Jake was strong in his stomach when he did his crunches. You could see that on both the upper and lower. And I guarantee you Jake's strong in his low back too, because it's what he does every day. But most patients cannot even perform this next exercise, and they realize real quickly this is the weak link in the chain. And I explained to them, as soon as this gets strong, you can kiss your back pain goodbye, okay? So I'm gonna turn the camera a little bit here, just a little, because we almost got them all. What Jake is gonna do, now his breathing instructions are the same, okay? Except what he's gonna do is he's gonna keep his legs straight without bending his knees, and he's breathing in through his nose, out his mouth. He's gonna raise his thighs and his pelvis off the table. And this is much harder. Go ahead, Jake. Yep, and Jake's strong, right? You can see his legs came up totally off the table, and he's even starting to get his pelvis off the table. If this table was a little harder, he'd be coming up even higher, but this has got a good 2-inch cushion on it, and that's why he's not coming up off with the pelvis, okay? So what I normally see with patients is they're weak in this one, okay? And what most patients can do, and Jake will demonstrate it, is they can barely get their ankles off the table. Right about, that's even more than most people, right? And what I tell them is, don't get discouraged because your range of motion and extension isn't good. Keep doing it, because as you do it, it gets stronger, and then those legs will come up higher and higher and higher until eventually the pelvis is coming up off the table too, okay? Jake, thank you for doing that. If you want to jump up, we'll put in some closing remarks here. So, range of motion are easy. That's the first step. Stretches feel good. Core strengthening suck, right? Everybody hates those. I'll tell you this, the first week or two, everybody hates the core strengthening exercises because they're designed to build muscle. And when you haven't done any exercise in a long time and you build muscle, what do you get? You get sore. Yep. You get really sore, okay? So in the first week or two, everybody hates the core strengthening because it makes them sore. But as you get stronger, guess what? The soreness goes away, your posture improves, you feel everything tightening down, and these exercises quickly go from their least favorite to their most favorite, okay? These exercises, the core strengthening, I tell my degenerative disc patients, if you're smart, you will do these exercises every day for the rest of your life. If you're not smart, when you start feeling better, you'll stop doing them, and then 5 or 10 years down the road, I will see you back in here and we'll start a disc treatment plan all over again. Because a degenerative disc plan is, as the name implies, degenerative. If you don't keep those muscles, ligaments, and tendons strong around the spine, then the spine is bearing 100% of the weight, and it's not sharing the load with the muscles, ligaments, and tendons. Okay? Jake, input.
Oh, it was great. Like I said earlier, the strengthening up, but also the range of motion and the stretching is ideal. As you get older, you start to lose that. So staying on top of it, being proactive, even if you're not injured. Again, you want to try to live as long and as healthy life as you can. So again, being on top of your stretching, your range of motion, and your strengthening every day if you can is ideal. So
exactly right. And so when a patient completes a spinal rehab program at my office, the instructions I give them are these. Core strengthening every day. Range of motion stretching alternating with core strengthening. Right? So on Monday we'll do range of motion with core strengthening. On Tuesday we'll do stretching with core strengthening. On Wednesday, range of motion, core strengthening. Thursday, stretching, core strengthening, right? And the patients, I see them down the road and they are the happiest they've ever been because they feel good, they're strong, and they're able to be active and they don't have pain. The bad part for me is when this all happens, I just don't see them as much because they're not in pain, they don't come to my office. But that's not a bad thing, that's a good thing, because then they tell all their friends and family too, and then they're in my office, okay? So once again, I'm Dr. Sean Branham. My business is Premier Healthcare. My website is drsseanbranham.com, and this is
Jake Bryan. I'm with Next Level Performance, and you can find us on Facebook or Instagram at Next Level Performance STL.